Hi, everyone, and welcome to today's webinar on community needs assessments and privacy. This webinar is co-hosted by the National Congress of American Indians Fund, the Tribal Law and Policy Institute, and First Pick Incorporated. Before we begin today, we'll go over some housekeeping tips to ensure everyone knows how to participate in today's webinar. Your control panel will appear on your user screen as shown on the slide. To minimize the control panel, use the orange arrow at the top left. All attendees will be muted during the presentation. Once you call into the meeting line, enter your audio PIN, which is shown in your control panel. Use the question box on your panel to submit any questions and responses via text. During the discussion portion of the webinar, please raise your hand by clicking on the signal, the hand icon signal to be unmuted. Everyone will receive an email with a link to a survey about today's session. And after the webinar, a recording will be made available on www.tribalvictimservices.org. And we have one handout for you today. It's just a PDF of the PowerPoint slides, and you'll find that in the handout section in your control panel. And again, welcome everyone to today's webinar. Today, we are going to be providing guidance on how to safely and securely conduct a community needs assessment while maintaining victim privacy. Our presenters today are Lana Hunter, Tribal Victim Resource Specialist at the Tribal Law and Policy Institute, and Heather Torres, Program Director at the Tribal Law and Policy Institute. And I will turn it over to Lana to get us started.
Thank you, Abby, and welcome to all of our tribal subgrantees who are working with us on this microgrant opportunity for victim services in Indian country. Next slide. I would like to let folks know that this is an opportunity for us to be able to tell the story of what is happening in our, sorry, Abby, the slide previous, what is happening in our communities. I was able to work with tribes at a Department of Health here in Minnesota, and to be able to collect data and collect information regarding programming, regarding trauma, regarding telling a story in their communities. And one of the things that struck me was how we oftentimes focus on more of a Western view of what data and understanding the relationship to that data. However, it is sacred knowledge. It's information that we're gathering from our tribal communities, and awesome opportunities to be able to tell our own stories. Because essentially all of our tribal clans, programs, systems are all natural orators. And for us, it's the opportunity for us to be able to tell our own stories on our own terms, essentially keeping our data sovereign. So I wanted to share a quick story that I was able to learn in my time being able to travel the country and talk to elders and gain permission to tell stories. The story of the seed basket is a story of a tribal community located in the Southwest. And a long, long time ago, there was a basket of seeds that this village fought over. And there was so much infighting and so many arguments about who was going to receive the basket of seeds that nobody noticed what was happening in the community. Nobody paid attention to the young people. Nobody was noticing what was happening around them. And this young woman was so concerned that her village was fighting all the time, that it made her ill, made her sick. And she fell ill and fell onto the ground, and no one noticed because no one was paying attention. And this young woman fell so sick that when she closed her eyes, she could see a pathway to the clouds. She could see where she could travel along this purple skyway that contained all of the sand, the dust that was in her village. And so she watched her feet as she walked towards the skyway, and all of the little cloud dust were billowing around her feet as she made her way. And as she got closer to the skyway, she realized that she was close to a river. She could see a river, a beautiful winding river. So she followed along that river, past the little flowers. She looked all around her and the birds were singing. And she noticed someone sitting on the bank of the river. And as she got closer, she realized it was her grandmother. So she traveled close to her grandmother, and she was so happy to see her. She hadn't seen her for a long time, not since she traveled to the spirit world. So she ran over to her grandmother and she told her that she was so happy to see her. And then she had a look on her face, and her grandmother asked her what was wrong. And she told her grandmother about all the fighting over a basket of seeds, all of the fighting in the village, and that she didn't know what to do. And she asked her grandmother if she could stay with her. Her grandmother replied, "No, granddaughter. My girl, you have to go back. You have to go back because there are songs and stories that can help our people, but only you can share them." And so she whispered to her granddaughter what she had been told, the song, the story. And as her granddaughter listened, she became hopeful. She understood. She remembered the song. She remembered the story. And she hugged her grandmother goodbye. And she walked along that river, past those little flowers, down, down, until she reached the place where the sand was billowing around her feet. And then she opened her eyes. And she realized that no one had noticed that she had fallen ill because they were still fighting. So she stood up and she walked to where everyone was arguing over this basket of seeds. And she began to sing the song. And then she told them the story that her grandmother had shared. And one by one, everyone started to listen to her. One by one, everyone understood. One by one, everyone knew that this was the sacred knowledge that she was sharing with them. So they took the basket of seeds, and each person took one seed, one or two seeds, and passed it on to the next. So that's the story of the seed basket. Next slide. So when we think about how we have this opportunity to tell our stories, we want to be able to tell the stories, to be able to sing the song, to be able to tell the story of what is happening in our communities, and to be able to not just listen to the young people, like in this story, but be able to listen to those that we know have a story to tell. And so we may have anecdotal information about our communities, about our villages, about our clan systems, about our criminal justice system, or lack of criminal justice system. And we want to be able to have this opportunity to decide who is going to tell the story, who are we going to survey. And similarly, we want to understand how we're protecting the storytellers. So who are we surveying? If we're surveying folks within our tribal service programs, how are we keeping their identity confidential and private so that they're able to tell a story completely and wholly without any retaliation? And similarly for victims, if they're able to talk about their process within the criminal justice system, whether that be tribal, county, federal, state, that we have this opportunity for them to be able to tell their story completely and wholly while protecting them. And so understanding that this is not just any story, this is your tribal program story, and it's what is happening for victims of crime. And so from this story, we're able to take that information, we're able to do the opportunity and to give voice to those folks who are willing to share that information with us and those victims who are brave enough and courageous enough to come forward. Next slide. So we want to also understand who will be responsible for the data that's collected. And so we'll talk a little bit more about what kind of data that you would be collecting while you're doing these community needs assessment. But just at the baseline of confidentiality and safety, understanding that all confidential data, so whether this is a survey link, whether this is the identity of the folks who are surveyed, whether they're victims of crime or they're tribal employees or they're county employees, or they're within a federal system and responders, that this information that you're collecting should be stored on a password protected laptop or in a locked cabinet so that there are only a few folks, either 1 to 2 employees, who will be responsible for keeping that data safe so that they are the ones who know the identity of those who have submitted their questionnaire survey, and that they understand that they're keeping this information confidential and private, and that they will be the only folks who will have access to all of the completed surveys with any personal identifying information. Next slide. So next I want to turn it over to my colleague, Heather Torres.
Thank you, Lana, and hello, everyone. Thank you for being with us today. Another piece to think about when thinking what sort of story do you all want to tell about your victim service program, what's happening to victims in your community, we have to think about how those stories will be gathered or collected, right? And so there's a few options and a few ways you can think through this. You can go digitally through a link such as SurveyMonkey. This might, especially during these times, this may be the safest social distance mechanism for some folks. You could try in-person community needs assessments. This can be done at an already established socially distanced event where you have a person sort of facilitating and there for support for anyone who's completing the needs assessment. You may also try a focus group. Some of you may already know who you would like to answer, who your audience is going to be for the community needs assessment. So you can consider setting up at, again, a socially distanced event or multiple events around the community. Or you can try web platforms such as Zoom and GoToMeeting, where you can set up privacy protections, record, but you always got to think through remember to think through who is going to be responsible for the data as well. This is especially important if you are thinking about working with a consultant or outside agency to help you complete the needs assessment. Next slide. So how will you handle the data, stories, information collected in your community needs assessments? If the data is collected digitally, there are mechanisms within platforms like SurveyMonkey that will allow you to pull information or summarize the data into chart format, summarize comments, etc. If you're collecting data in paper copies, you'll want to make sure to outline a systemic process to make sure that you're gathering the needs assessments, such as a manila envelope or box to collect surveys. And you can also ensure that you are including what you will do with the data and when you will destroy and delete the data once the grant period has ended. So you want to make sure to communicate that. And it's especially important to highlight that for this particular program, one of our special conditions is to keep documentation for at least 3 years. So whether you're doing the surveys or your community needs assessments digitally or via paper, you always want to communicate what will be done with the data and how you're going to protect it, and as well as when you will be destroying and how you'll be just deleting the data. Next slide. All right, so along those lines, what else are we trying to communicate to participants? It's always important to keep in mind that when you're asking folks to participate in a community needs assessment, you're possibly talking about things like gaps in safety. What is working or not working for victims of crime in your community? Or you may be focused on what systems are available and working with county, federal partners. So to figure out what resources are available. So you really have to let participants know that the information you're collecting in the community needs assessment will not contain any personal identifying information when you share the final outcome or report that summarizes what you learned from the community needs assessment. Also, it'll be really important to put the contact information, most important, to put the contact information for an advocate or counselor. This is especially important if you are going to be surveying victims and survivors in your community. That way, the advocate or counselor may be there for the victim to help answer about their experience and to help them through the completion of the community needs assessment. So especially if you're kind of trying to figure out what gaps there were or what services that they may have received. So having that advocate or counselor there is going to be really important, especially if you will be surveying victims. Next slide. And I think here I'm turning it over to Lana to talk about a little bit more about the audience you want to survey.
Thank you, Heather. So I think one of the most important opportunities that we have is we're understanding that there is anecdotal information in the community. So, for example, if you're starting an elder domestic abuse or domestic violence program, that you're understanding that there is some anecdotal information, such as victims, elder victims are not reporting, and maybe you want to understand why you believe they're not reporting, or you want to understand the scope of the problem. And so this is really critical in terms of your decision within the tribe, within the community, to understand who is best positioned to tell this story. And so it may be service providers that work with the elder programming, such as nutrition services. Right now, during time of COVID, there may be community health aides or community health workers that go into the homes. It may be any kind of social services that are, connected to any TANF or other social services that they may be receiving. So we may believe that those folks would best be positioned to tell the stories without going directly to the elders and asking. The other opportunity is to ask elders directly. And there have been a number of tribal programs who have surveyed elders, and they've done this through various ways or communication. And one way would be in their nutrition packets or meals that you're delivering. It could be an opportunity for a community health aide or someone that works with your program to let them know about the survey. And if they agree to do the survey, that you would have one of your 2 employees that have access to this data either come to deliver a survey and or provide a verbal kind of walk through that process as well as recording, just because there may not be access to taking an online survey for elders. So this is why it's so critical and important to decide who your audience is, what access they have or don't have in terms of accessing your survey, and then how do we keep that information private? How do we keep them safe? And so when we think about perhaps administering a verbal communication, reading through the questions for elders, we have to consider, are they going to be safe in their home to answer those questions? Is there another way that we could administer? Or maybe this is the time or the decision to be able to go to service providers who work directly with elders and ask them what they believe would be the most effective services, programming for victims of elder abuse in the community, or what they believe is lacking. So the other example is understanding that there's a lack of safe shelter in your community, and you want to expand to include service providers who know that firsthand of how this knowledge affects the community. And so one example for this is within a community that I recently worked in within the last year. They understood that this was an issue in terms of safe shelter because the social services program was receiving crisis calls 24 hours, kind of around the clock, from victims who had nowhere to go and didn't know how to access safe shelter in the community. And once the social services directors and folks understood that they would have to travel 35 miles to get to a safe shelter, this was kind of their prompting of that anecdotal information to understand completely how this affects community members if they do not have access to safe shelter. And so they decided to survey the other service providers, so social services, as well as education, so schools, and just in terms of understanding how this would adversely affect someone if they did not have access to safe shelter, or if they felt they had to leave the community to access any kind of safe shelter. So just understanding who your audience is and understanding what you want to learn and understanding what you already know in the community. And again, this is anecdotal information. This is calls coming into your tribal programs. And if you're a new tribal program and you've never had victim services, you may want to understand what the priorities are in the community for victims of crime. And again, this could be understanding if having a 24-hour crisis line is the priority. Perhaps it's having a safe place to come and talk with an advocate. Perhaps it's accompaniment to court or any kind of sexual assault or forensic exams for victims of crime, whether those be children or adults who are victims of sexual assault. So you may want to understand where the focus for an advocate in your community would start. And similarly, what those priorities are, this is the opportunity for you to then communicate back out to the community what the survey results are, how you arrived at understanding that this is the most important focus right now for the tribe. And perhaps, for example, if it's setting up a safe shelter, maybe that's the number one priority for your community. You have a local casino, or you have local opportunities in a neighboring community that's not 35 miles. Maybe it's a vacant home, whatever that looks like, that you have the understanding that safe shelter is the most important opportunity for victims of crime to be safe. And so setting up, safe stays at the casino is the priority. And then having a way to communicate back out those survey results to the community, along with any additional information that you learned from your community needs assessment. Next slide. So next is understanding what kind of questions we want to ask in our community needs assessment. So going through kind of technical terms, when we look at qualitative data, this is qualitative data focuses on perhaps open-ended questions. And so allowing for the participants in the community needs assessment to answer in a paragraph form, a sentence form, something other than an actual checkbox or priority list. So this is data that's not easily compiled. So when you think about what kind of questions we want to ask our community, when you decide who your audience is, what you want to learn, now you're at the place of understanding what kinds of questions you would like to ask. So qualitative data is not easily compiled. So you're going to focus on your opportunity to take this information at the very end of your surveys, and you're going to have to compile it. So qualitative data, you're going to have to record every single answer. And if there are similar answers, say shelter, and then there's a description, you can compile all of the shelter into one, but you'll still have to find a way to include the data that is beyond answering that first question, so that you're representing all of the voices who have shared in the survey. So the additional questions that we can ask are quantitative data. So this is data that's easily compiled. So, a finding with your tribal service providers or tribal programs, maybe that 75% of the service providers believe that domestic violence is the number one safety issue in our community. So this is data that is easily compiled, and we'll go over some of the quantitative questions that you can ask at the end of today's webinar. Next slide. So this is an example of what you can ask in terms of having a new tribal program. When you're asking victim service providers or other tribal service providers, these are those types of quantitative questions that are easily compiled. This is not a complete list by any means. So if there are additional crimes that you are seeing in your community that you would like to add onto here, please feel free to do so. This is a list that we compiled from the Office of Victims of Crime. And so it may not be, specific to your tribal community. but which crimes do you believe are impacting the community the most? And so, this just gives the opportunity of a checkbox to check those crimes. Also, you can ask, listing from 1 to 3, what do you believe are the 3 top concerns, safety issues, safety gaps in our community? And so from there, you can compile, kind of where your focus is going to be, or if you already know your focus is going to be on elder abuse, you can list the types of victimization. So of the elders that you are working with or that you are seeing, please list in priority what you believe are the maybe top 3 kind of safety concerns for elders at this time. And you can list financial crimes, verbal abuse, so just so you understand that this is an opportunity for you to gather priorities from the community in a kind of simple process that will allow you to pull this data to direct you within your strategic planning, community awareness, community education, whatever you're using the data for. I'll turn it back over to my colleague, Heather.
Thank you, Lana. Here is another sample question that could also be considered a quantitative approach, where you can have folks just check off a box that applies to them. And this question is kind of looking at systems and looking at a systems approach. So this sample question asks, which of the following best describes the agency for which you work? So if you're taking this, we kind of want to know what systems are available, what services are available, which systems can victims reach out to for help, where do we have gaps? This is a great question to ask. Again, this is just a sample, so you'll want to make sure that you include the services for which and the systems for which are available, as well as some maybe some systems you're curious about if they're operating or available for victims, so you add them to this list here. But again, this is just a sample looking at the legal side, district attorneys, police department, lawyers, looking at the health side, health and medical services, nonprofit agencies, etc. And this would actually be a really great question too if you ended up choosing a digital route where you have folks complete an online survey. And I say that because say you want to filter and see how different agencies responded to your survey. Those online survey functions have the ability for you to filter answers. So for example, if you wanted to focus on what the health and medical services folks were saying on this survey, you can actually filter that by saying, hey, I want to look at all of the folks who checked health and medical services for this question. I want to look at their survey responses on the rest of the questions in the community needs assessment. And that might be helpful because you may be able to do some comparisons where maybe the police department is answering the survey different than the health or medical services, or the tribal victim services program is answering differently from the tribal court. So this is another sample question to get out there, especially if you are trying to look at what systems are available to respond to the needs of victims. And I'll turn it back over to Lana for the next question.
Thank you, Heather. So the last 2 questions were focused exclusively on tribal service providers and or county and or federal, depending on where your jurisdiction and or your focus for the survey is. And so these next couple of slides are focused more as sample questions for victims of crime. And again, as Heather pointed out earlier in the webinar, one of the most important processes for working and surveying victims of crime is that you have information regarding a victim advocate or counselor that would be available in case they may be triggered by any of the questions that you're asking in the survey. Again, you're asking them to recall any type of crime, victimization that happened, and then what help was available to them at that time. And so, as you know, working with victims of crime, no matter how much time has passed, even if it's, as these questions kind of lay out 2 years, 3 to 5 years, or 5 years or more, when we deal with victims who have experienced trauma, such as sexual assault, domestic violence, even child sexual abuse, our minds may be able to differentiate that there is a time period that has passed. However, our bodies and the trauma that we've experienced may not understand those timelines. And so anytime that we're talking with victims of crime, we're understanding that as they recall events, as they recall anything that has happened to them in their, as I call, soul wounds, understand that there is no timeline. Your body's not able to differentiate in terms of, oh, okay, well, this happened 10 years ago. Oftentimes it's as though we're experiencing it at that time. And so it's just important, even though in our minds we think, well, this happened, 10 years ago, or we don't really, maybe understand the full scope of soul wounds and trauma and impacts for victims, that it's easy to think that we're just doing a survey, but to fully understand that, just having an advocate available, a phone number, having a counselor that's on staff or someone that's safe, that would be able to talk to folks regarding surveys. And so I just wanted to share that because I think it's important as we're asking these questions to really keep in mind, which audience we're selecting to take the survey. So some questions to ask for victims who experience crimes. Have you been a victim of crime in the past? And so, you may find that somebody would mark 2 years or less, as well as 5 years ago. So maybe there's a couple different scenarios for them. And then, did you seek help in the past? And so, again, answering the questions 2 years or less, 3 to 5 years, and then 5 years or more. Next slide. Heather?
Yes, thank you, Lana. And as Lana mentioned, we kind of shifted now to some sample questions for victims who may be completing your community needs assessment. And here, these are some sample questions that sort of take a blended approach where it's quantitative and qualitative, where you can collect quantitative data on folks who are simply answering a yes or no question. But if they provide that other and specify their answers, that helps you collect some qualitative data as well. So the first sample question, do you know what local services are available to help crime victims? This is a great question to just kind of get a baseline of folks' awareness and folks' awareness of the services that are available. And if there's not awareness, that's a great indicator as well for folks to see what types of education and awareness needs to happen in the community. Another question that's laid out here is, was the help you received useful? And again, using that combination approach of yes or no questions, but allowing space for victims to share their voice and their experience, and be able to detail what was particularly useful. This is great information, especially as you all are considering what ways to create new programs, what crimes to address, what services to provide, as well as folks who are looking to expand and seeing what services have been useful in the past and what can those be expanded? Can those be what else can be added to complement those services? So here, these are just great questions to kind of, again, give you that sort of knowledge baseline of what's available, awareness levels, what was helpful or useful in the community. And that allows you to really focus in and try to help you figure out, especially if you're entering into strategic planning as well, to give you some guidance and direction of how of where you need to plan moving forward. Lana, I don't know if there's anything else you'd want to add on this one.
No, I think that's great.
Okay, great. Then we'll go ahead and go to the next slide, and I'll turn it back over to Lana.
Thank you, Heather. So I think, in terms of understanding why we're doing programming, understand, how we're doing programming, I think we also need to understand why victims of crime may not feel comfortable reporting. I've had the pleasure of reviewing grants for the Office of Violence on Office of Victims of Crime, as well as the Office on Violence Against Women and the Bureau of Justice Assistance in the past. And I've noticed that one of the, I guess, outcomes that tribes often point to as they're gearing up to do a new tribal program, one of the goals that they mention in their grant or narrative is that they share that one of their goals is to not see victims, not see as many calls to law enforcement. So those numbers of calls or crisis calls to law enforcement would go down. And that would be an indicator of how well they're doing in the community. And, I'd like to point out to folks who are just starting out in tribal victim service programming is to understand that when we think of reporting crimes, whether those are person crimes or non-person crimes, such as robbery, financial theft, anything of that nature, we know that with person crimes that we have only about 50%, if that, of victims reporting. And so if we're understanding that if we're providing a safe environment for victims to come forward, we would not see that number go down. We would see that number increase of victims coming forward. And so it's not always an accurate indicator of why or how well we're doing if we have less calls to law enforcement, because we know these crimes are occurring in our communities. We want to be able to understand that if we're increasing calls, crisis calls to your new program, that we are making it much more safe for victims to come forward. And so that's always the focus when we think about what does safety look like? How does it, our community, make it more accessible and safe for victims to come forward? And so one of those ways of understanding that is understanding why they did not come forward previously. And so, there's a number of reasons that they would not report a crime. And one, as you see, I didn't think anything could be done. And so, maybe there has been in your tribal community, maybe they have seen for other victims who have come forward, or they have seen in the county that law enforcement and or judges and or those who are holding the perpetrators accountable are not holding them accountable. And so they're seeing that, nothing could be done. I felt too ashamed, embarrassed, depressed, or even traumatized to ask for help. And so again, understanding that whether it's a person crime or it is a non-person crime, that there's often a lot of shame attached to reporting crimes, that they should have known better. Maybe it's, for elder abuse, it's a grandchild. And so understanding, that there are a number of reasons why someone would not report a crime. And so understanding what systems you have in place to hold folks accountable, but also to break down those barriers of shame. And a lot of those ways of breaking down feeling ashamed or embarrassed or depressed is to do the community education, community awareness. I've seen tribal programs, put ads on the radio, the local radio station. There have been signs that have been hung up in the casino. Maybe they're in the restrooms, maybe they're, inside the bathroom, so that we find a way to allow for victims to not feel ashamed, embarrassed, and understand that there's safety in them coming forward, and how to access those services. And additionally, I'll just point out a couple more examples. The crime was not reported to the police. And so this may be where your tribal community does not have their own law enforcement. Perhaps you're contracting law enforcement services in your tribal community from the local county jurisdiction. And so, this is a real example, but one of the tribal communities understood that every time a local tribal member called the police, they would show up with 2 squad cars. And this was because of, the county's kind of reticent, apprehension to come onto a tribal community because of their own, prejudice or fear, whatever that looked like. And so tribal members were not calling law enforcement when there was a crisis happening. And so understanding that that's a huge barrier. And so for that community, their focus was to get their own tribal law enforcement up and running and in place. And so within a year, they had 2 law enforcement officers. And we see that when our tribal communities are focused on providing our own tribal law enforcement and training them, and they're familiar with the community, they have the maybe cultural knowledge, that they're more based in community policing and safety, right? And so they may not have that understanding or fear factor of, not sure what they're walking into. Obviously, you want them trained in their arrest policies and procedures for safety, because domestic violence calls are the number one safety risks for law enforcement. So you want to ensure that they're trained, but also understanding that community policing, for an elder who's reporting a crime against her grandchild, she may feel or he may feel better if they know that a tribal law enforcement officer will show up and be more, understanding and working with the family, providing any services. Granted that it's not a person crime, so any domestic violence has not been committed, and maybe it's more focused on financial crimes, or we've seen recently where elders have had their pills or prescriptions go missing and they're reluctant to report their grandchild. When we have that community policing model, and or tribal community where we're responding not with punishment, but we're responding with services that we're able to understand that there may be substance use disorder with that grandchild or adult child, and respond with services. Right. Granted that there's no person crime occurring, that's a whole other safety risk. And so those are just a few of the examples of why, you would understand a community member not wanting to come forward or feeling safe. But there's also the opportunity to then respond with your priorities in your tribal community, with your community members, with community education, with crisis information, with community policing. That this is really that opportunity to look at all of our systems. And this is not to point fingers at any, specific system or any specific county. We're just wanting to understand how we can make tribal victim programs and services accessible, available, and safe without shame, embarrassment, or people being concerned about their family members in terms of, maybe they are struggling with substance use disorder and they are, taking, grandma or grandpa's per cap, every time, and understanding that we can respond in a sovereign way. So this is really understanding what the barriers are. This is not to point fingers. This is really to get to what we need to create wholly to respond to the needs of victims. Next slide. So the final process or the final ask that we are requesting from you folks who are working on community needs assessments, that you have the opportunity to either go through with us on our next call, which will be Thursday, December 3rd. We're going to walk through setting up a Survey Monkey, what some of the functions are within that Survey Monkey. But more importantly, we want to hear from you. What audience that you are thinking of surveying in your community. What do you want to learn from the community? And then, develop one or two questions that you would like to learn from the community. And then again, this is deciding if it's going to be digital or in person. And we'll walk through again those Survey Monkeys, but also if it's an in-person survey, how we collect that information, how we administer those surveys, and then decide anyone in your tribal program or tribe who can be a safe person to talk to if you are surveying victims and or tribal program service providers. And then this is similarly important to understand of how you're going to collect and keep the data safe. So these are some of the questions we're going to walk through with you folks on our next webinar, which is again Thursday, December 3rd. And we also have a list of those upcoming webinars. Next slide. So you'll see that there are upcoming webinars that are focused for this particular, so this is a smaller group of folks, so this is only for those of you who are working on community needs assessments. So that next one will be December 3rd. But before that, there is an opportunity for folks who are working on tribal codes or who are interested in tribal codes for victim services. That will be coming up on December 1st. December 8th is a financial online reporting webinar, and that will be on December 8th. This is a repeat of a webinar from October 7th. And as Abby mentioned, you can revisit all of our previous webinars at www.tribalvictimservices.org. And then December 15th, this is only for subgrantees who will be completing strategic planning, but we will have a strategic planning webinar on December 15th. And you will receive an invitation to that specific webinar. Next slide. I will turn it over to our colleague, Abby.
We do not have any questions at this time. If you do have any questions, there's some instructions on the screen. You can either use the question box on your control panel to submit the questions and responses, or if you'd like, you can click the little hand icon to raise your hand and we can unmute you to ask your question.
If there are no questions, Heather, did you have anything you wanted to share before we wrap up today's webinar?
You know what? I don't think so. Just to highlight the follow-up to this webinar, in its slide, the slide with 6 prompts, we're hoping that, again, we can walk through that with you on December 3rd. And just to note that that will happen on I believe that's a Thursday, instead of, I know some of our webinars have been falling on Tuesdays. So I just wanted to note that the next follow-up to this webinar is on a Thursday, and we're going to start a little later at 11 a.m. Pacific time. But thank you all so much for joining us today. I look forward to being with you all on the 3rd.
Thank you, Heather. Abby, did you have anything you wanted to share before we close today's webinar?
No, just thank you again, everyone, for joining us. I put the contact info up on the screen. If you have any questions at any time throughout the grant period, just feel free to reach out to anyone on the screen.
Wonderful. And we look forward to you folks joining us on December 3rd. Please remember, if you're not able to join the webinars, that all of these will be recorded and posted on our website. And for today's webinar, Abby will be collecting any of the surveys that she sends out, as well as sending out the PowerPoint again, as well as a link to the webinar within the next couple of days. So thank you all for joining us. Thank you for being here, and thank you for joining today's webinar with the National Congress of American Indians, First Pick, and the Tribal Law and Policy Institute.
Take care, everyone.